Good evening. Welcome to Good Shepherd Healthcare System's third annual community meeting. My name is Steve Eldrige. I'm board chair. This year we are presenting our annual community meeting via the internet. Due to COVID-19 in-person event restrictions set forth by our state government and the Oregon Health Authority, the health and safety of our patients, staff, and communities is our number one priority. And we are presenting virtually so that you are able to participate from the comfort and safety of your home. Next year, we look forward to having this event in person. We believe that an open community meeting format better serves to broaden community involvement and provide excellent opportunity and a larger forum for sharing improvements we are making, new services we are offering, and highlighting the ways we are striving to improve the health of our communities. Marketing and Communications Director Caitlin Kozad prepared this year's annual report, which can be viewed online at gshealth.org. This evening, my brief annual address will be followed by Good Shepherd's President and CEO, Brian Sims. Thank you again for joining us virtually tonight. We appreciate your interest, involvement, and participation. Now, thanks to our Board of Trustees for their continued service. This past year's officers, including myself, Nancy Mabry, Board Vice Chair, Sue Daggett, Board Secretary, Tom Walmsley, Board Treasurer, Trustees, Bob Carlson, Arnell Enan, Rachel Archer, Bill Elfring, John Lawrence, Dr. Derek Earl, Lisa Middlesdorf, Jeff Winholz. At our annual meeting of the board on Monday evening, we selected officers for the coming year. They are Sue Daggett, Board Chair, John Lawrence, Board Vice Chair, Arnell Enan, Secretary, and Bill Elfring, Treasurer. Being on the Board of Trustees at Good Shepherd allows us to work with an organization that consistently gives back to the communities it serves in many different ways. Tonight, you will learn about Good Shepherd impacts on our communities for this past fiscal year. As you may know, longtime President and CEO Dennis Burke retired on September 30th this year. Please join me in wishing Dennis and his wife Connie a long and happy retirement. To give us details of this past year of challenges and achievements, it is my pleasure to introduce Good Shepherd's new President and CEO, Mr. Brian Sims. Brian and his wife Tracy and son Nathan moved to Hermiston in September, and Brian began his position October 1st. Brian brings over 10 years of executive experience to Good Shepherd with a strong record of proven leadership and continual operational improvement. Help me welcome Brian.
Thank you, Steve, for that amazing introduction. As you know, my name is Brian Sims. I am the new CEO of Good Shepherd. I want to thank all of you for the support this community has given me and my family during our transition to Hermiston. Everyone we have met has just been amazing, and we are very thankful to be here. As a 20-year Air Force veteran, I got to tell you, it takes a team to run an organization this size. So thanks to Steve Eldrige and all of our trustees, because without them, without their leadership, Good Shepherd would find it very difficult to make the success that they've had this last year. Second, I want to say thanks to our outgoing CEO, Dennis Burke. You know, for 32 years, Dennis has been that beacon for Good Shepherd and one of the strongest advocates for healthcare, not only in the state of Oregon, but across the nation. Dennis's advocacy at the national level has made him very well known, including one CEO in a small town in Iowa, me. To have the opportunity to follow Dennis and lead one of the best known critical access hospitals in the nation is one of the greatest honors of my professional life. Third, I want to thank our senior team, our department heads, and medical staff leadership. In the early days of my tenure, I am depending on these leaders to guide me and advise me, and they are doing a magnificent job. And finally, just to our staff. Good Shepherd is 750 people strong. If it's not for our physicians, our practitioners, our nurses, our environmental and maintenance specialists, just to name a few, it would be very difficult to get things done. But I know that their focus is just one thing, and that's the patient. And finally, I want to thank you, our patients and our friends. You are the why in why we are here. You are the purpose, you are our mission, and that mission is to improve the health of our community. It's an awesome and one of the most humbling purposes any one person can have. My goal each and every day is to make sure our patients feels just a little bit better going out the door than when they came in. This philosophy for our patients did not just happen overnight. It developed over time, starting when I was 10. I grew up in a small town in Arkansas, and I was literally surrounded by nurses, to include my mom and my aunt. There were many times my mom would take me to work with her, and I would get to sleep in the hospital at night. I saw for myself that purpose, that wanting to make a difference in a person's life and a commitment to worthwhile work. After attending Arkansas State for a couple years, not knowing what I really wanted to do because I was pretty determined that I did not want to work in healthcare, I joined the Air Force. And after the Air Force, I managed to find my way back into healthcare. My very amazing wife, Tracy, and our youngest son, Nathan, are here with me in Hermiston. Our older children, Josh, Crystal, and Elizabeth, are still in Des Moines with their own families. Tracy and I are blessed with 4 grandchildren, Lexi, Evan, Delaney, and Evelyn. So that's really enough about me. Let's talk about how great Good Shepherd really is and what the accomplishment we achieved this last year. It first starts off with our programs and equipment. With Physical Medicine and Rehabilitation Center, we built that space out, and that clinic opened up in the summer of 2020. Good Shepherd also opened up a cancer center in December of 2019. We also completed a cardiopulmonary rehab expansion in April of 2020. And coming soon in November, Good Shepherd Sleep Solutions construction was completed and it will be opened. I think we're expecting a lot of great things come from each one of these areas just to better serve you. In addition to all that, we saw new providers and new physicians that came into the area and into Good Shepherd. So in addition to the wonderful work we've done as far as our facilities are concerned, we've done a magnificent job in recruiting physicians to Good Shepherd. First of all, in internal medicine, we brought in Dr. Bradley Timchuk, our certified nurse midwife, Cynthia Rice, Dr. Newtune, another internal medicine physician, Dr. James Whittam, which is orthopedics, Dr. Timothy Thompson, internal medicine, Dr. Guy Fogg, internal medicine and a hospitalist, Dr. Stephen Iacoboni in hematology and oncology, Dr. David Shanley, family medicine, Dr. Christopher Bowen, OBGYN, and Dr. Snyder, another OBGYN physician. Again, coming soon into our sleep medicine is Dr. Jack. In addition to the facility upgrades and the amazing recruiting activities that we've had over the last year, we've also focused on our electronic medical records. We've created a My Health portal team to address additional functionality and increase in use of our portal, which includes education for our patient and in clinics during their visits. We've also worked closely with our partner, Legacy Health, to ensure proper COVID-19 operations, including data gathering for mandatory reporting. We've also provided support for our Sleep Solution Clinic expansion project. In spite of being faced with the challenges of the coronavirus this last year, and in spite of our patient days being down by 24% because of COVID-19, our outpatients visits are still up by 6.3%, and our clinics, including our urgent care clinic, was up by 8.7%. We applied additional funds for buildings and development of $8.1 million, and we're going to continue to go in that direction. Our additions to reserves, due in large part of operating income, increased. although our costs are increasing again, such as labor costs and pharmaceuticals and regulatory costs, we continue to be strong. We still are focused on charity care, and we intend to put another $6 million into charity care. So what makes an organization great is more than just the money. It really is about how well do we serve our patient and the patient satisfaction. Good Shepherd just finished the 4th year and preparing for the 5th journey to become a healthcare system of choice. We have a coordinated effort to improve the patient, employee, and the provider experience. We are encouraging problem solving, continuous improvement, and greater efficiency across Good Shepherd. Focusing on building a stronger culture where we all work together to ensure one thing, that our patient feels just a little bit better going out the door than when they came in. And part of that is recognizing our folks. Over the last year, Good Shepherd has also had some awards and special recognition come its way. First of all, I'm very proud to report for the 4th time, Good Shepherd was recognized as one of the top workplaces in Oregon. We also received a 5 Summit Awards nomination through Custom Learning Systems at the 2020 Healthcare Service Excellence Conference. We also had some individual winners. Janine Barnt won the Service Excellent Mentor from the Quality Department. Ashley Lehman, a nurse in our emergency department, was identified as the exceptional nurse. The Do It Improvement of the Year came from the emergency department psych menu project spearheaded by Jennifer Tullock and Monica Betts. Medical Clinic of Choice was the Good Shepherd Women's Center. Our Service Excellence Council won the annual Pinnacle Award. Also in the year, Good Shepherd achieved our merit-based incentive system, MIPS, exceptional performance status, attesting with 100 out of 100 points for year 3 of the program. We also achieved 14 out of 19 quality metrics, resulting in an 80% quality bonus award, and met 4 out of the 4 challenge pull metrics from the EOCCO. Recently, our annual D&V accreditation survey commented about the Herculean efforts that Good Shepherd has made during the COVID-19 pandemic. And in fact, they said it was the best they'd seen this year. Our Good Shepherd Community Health Foundation, I'd just like to say thanks to our board president, Margaret Saylor, and foundation director, Bob Green. In the last year, they have dispersed $192,920 in grants and $32,500 in medical scholarships to 22 students in the area, going to 17 various colleges and universities. We also had the Christmas Spirit Award, and those recipients in 2019 was Roger and Karen Bounds and Charlie and Carol Klumpney. The 2019 Festival of Trees was an immediate sellout with over 350 attendees. Over $23,000 was raised for the foundation. Unfortunately, the Festival of Trees is canceled for this year due to COVID-19. In June of 2020, the 26th annual Scramble for Scholarships was canceled due to the COVID-19 pandemic. And in 2019, this event raised over $33,000 for medical scholarships. We're very hopeful that at some point in time, once we get past COVID-19, that we're going to be able to get back into doing these things again. The foundation is a very important part of any healthcare, and for the work they do in serving this community is just amazing, and we want to thank them very much. In addition, I have to say thanks to our volunteers. Unfortunately, during COVID-19, they have not been very active within Good Shepherd, but I can tell you, any CEO will tell you that volunteers is the lifeblood of any hospital. So with that said, I want to say thank you to Auxiliary President Tim Glass and Volunteer Services Manager Cindy Shawn. The Auxiliary donated $19,000 to the hospital for medical equipment, and they also contributed $10,000 in scholarships, $2,000 to 5 different individuals. 70 auxiliary members, 10 junior volunteers, and 11 caravan volunteers gave over 10,000 hours. And though our volunteers have not been with us for their health and safety, they have supported us remotely, sewing together cloth masks for our staff. So what about the future? Well, I'm going to tell you that the future is great for Good Shepherd. We are looking for a strong industrial medicine program and additional hospital housing. We are also looking at recruiting more physicians for the area. In conclusion, I just want to say thank you. It's been an honor to be here with you all tonight. And it is absolutely my pleasure to serve. As a personal plea, I'm going to ask you, if you have not been going to the doctor because of the coronavirus, I'm going to ask you to go. It is safe. We will take care of you, and we will make sure that you are well taken care of. Also, it is my hope that when you visit us again, you will see that Good Shepherd's experience through our amazing people. We are here to serve you. And thank you to our marketing and administration departments for organizing this event. And be sure to review the annual report online at our website, gshealth.org. Also, we will be mailing it out to communities within our service area in November. So, thank you again. I'm going to turn this back over to Steve.
Thank you, Brian, for your presentation. And thank you to the rest of Good Shepherd's executive team. Chief Operating Officer Jim Schlinker, Chief Financial Officer Jan Peter, Vice President of Nursing Brian Patrick, Vice President of Human Resources Kelly Sanders, Vice President of Good Shepherd Medical Group Troy Legore. It is impressive to hear just how much Good Shepherd accomplishes each year, especially in this year of the pandemic. We acknowledge Good Shepherd employees for their continued hard work and dedication during these unprecedented times. And that concludes this evening's program. Thank you again for joining us virtually. We hope to see you in person at next year's annual community membership meeting.